Hello, my name is Alan Manovitz, and I have practiced psychiatry in Manhattan for over 25 years. My partner, Dr. Jim Halper, and I have always searched for scientifically proven innovations to resolve mental health illnesses for our patients. This presentation is about a treatment technology called transcranial magnetic stimulation, also known as TMS therapy. I will present our experience of using TMS therapy as a treatment for depression and the financial opportunity to expand clinical access of TMS therapy to 100 centers. In the U.S., 1 out of 5 people have a psychiatric illness. The prevalence can best be recognized as you consider that 1 in 2 families have a family member that suffers with a psychiatric illness. These illnesses include depression, anxiety, obsessive compulsive disorder, post-traumatic stress disorder, and many other mental health burdens. One of the largest segments of psychiatric illness is depression. The National Institute of Mental Health studied depression in the U.S. and found that 6.9% of the population, which is over 6 million people, suffer from clinical depression. Of the 6 million, approximately half, or 8.2 million, actually seek treatment. Of those that seek treatment from medications and talk therapy, about 4.5 million remain suffering. This study clearly showed a major problem in treating depression, whereby 50% are not treated, and those that are treated, only 40% are treated effectively. We know that the brain biology, which is the chemical and physiological makeup of the brain, is affected by genetics, environmental factors, and the treatments that we use. What we eat, how we sleep, the type of exercise we take, our careers and relationships, medications we take, all of these influence the biology of the brain. In modern-day psychiatry, we primarily treat the biology of the brain with medications and talk therapy. We know through scientific research that each of these therapies changes brain biology. As psychiatrists, our primary tool in treating depression is psychiatric medications. Although medications yield significant promise for patients, they come with unwanted side effects. These side effects are significant and include weight gain, sexual dysfunction, gastrointestinal problems, fatigue, changes in blood pressure and heart rate, anxiety, dry mouth, and for many, especially seniors, dangerous drug interactions with non-psychiatric medications. An important factor with psychiatric medications is to understand the threshold of gaining FDA approval. The majority of medications only have to work 1/3 of the time to be deemed effective by the FDA. This means that over 50% of people do not get satisfactory results with their first medication. Poor results are attributed to either lack of symptom relief or side effects that outweigh the benefits. So the routine of most psychiatrists, including myself, is to prescribe another medication. Yet, with each medication trial, the likelihood of the next medication working declines significantly, and patient dropout increases. As you can understand, psychiatric medications are not like antibiotics, where the majority of patients get well. This leaves a tremendous opportunity to solve this dilemma. TMS therapy was discovered in a study unrelated to mental health. Participants were being given MRIs in an attempt to map the areas of the brain related to movement. Several of the participants in the study voiced the same side effect, and that was that their mood had improved. Positive mood is the antithesis of depression. Those with depression do not have positive mood levels. This finding led to scientific research in an attempt to validate the use of magnetic pulses, which is the mechanism of action of MRIs, to raise positive mood levels. To begin research, they miniaturized the MRI magnetic coil to a unit that is about the size of the hand. Several advantages were seen by using an MRI-based system, one being 50 years of safety data. They named the technology transcranial magnetic stimulation, or TMS therapy. TMS therapy uses pulsed magnetic stimulation to excite the brain cells. Each brain cell has a plus and minus gradient. The TMS therapy pulse stimulates the nerve cell by changing the polarity of the cell. This principle is called Faraday's law. The law states that a pulsed magnetic wave perpendicular to the magnet induces an enhanced electrical field. This enhanced electrical field causes a neuron to fire, and this is called an action potential. The action potential then causes the release of neurotransmitter chemicals. The increase in neurotransmitters is the same result as with psychiatric medications, except TMS causes this holistically without the side effect profile seen with medications. TMS therapy also results in physiological changes in the brain. For example, when you're 2 years old, your nerve cells overlap densely. These are called an axon and a dendrite. The brain is at its peak for the first 20 years. After that time, the brain connections begin to get further apart. The brain, just like all other organs, begins to deteriorate over time. The abilities of the nerve cells start to disconnect. What medications do is not cause more chemicals, but they cause the nerve cells to work more efficiently. We believe that TMS applied to the brain stimulates the brain and rejuvenates the connections and also creates new connections, thereby normalizing brain activity. For many years of research, a clinical trial was funded to see if TMS therapy could improve depressive symptoms. Depression was chosen because of the high patient population and the support of scientific research literature. The first clinical trial involved over 300 individuals. This trial and subsequently 2 other trials proved the effectiveness of TMS therapy. Each was granted FDA approval upon their own merit. This enhanced electrical field causes a neuron, the brain cell, to fire, and this is called an action potential. The action potential then causes the release of neurotransmitter chemicals. The increase in neurotransmitters is the same result as with psychiatric medications, except TMS causes this holistically without the side effect profile seen with medications. TMS therapy also results in physiological changes in the brain. For example, when you're 2 years old, your nerve cells overlap densely. These are called an axon and a dendrite. The brain is at its peak for the first 20 years. After that time, the brain connections begin to get further apart. The brain, just like all other organs, begins to deteriorate at some point. The abilities of the nerve cells start to disconnect. What medications do is not cause more chemicals, but they cause the nerve cells to work more efficiently. We believe that TMS applied to the brain stimulates the brain and rejuvenates the connections and also creates new connections, thereby normalizing brain activity. After many years of research, a clinical trial was funded to see if TMS therapy could improve depressive symptoms. Depression was chosen because of the high patient population and the support of scientific research literature. The first clinical trial involved over 300 individuals. This trial and subsequently 2 other trials proved the effectiveness of TMS therapy. Each was granted FDA approval upon their own merits. TMS therapy was approved by the FDA in 2008. We were one of the first of 3 centers in the U.S. to begin using TMS therapy. We knew TMS therapy had promise when Dr. Halper and I introduced TMS therapy to the New York market in 2009. This was at the worst economic downturn seen in a while. Yet, we had hardened, clinically depressed New Yorkers wanting relief from their depression. Both our patients and us were excited about the promise, but as New Yorkers, we have a prove it to me mentality to see if TMS therapy was going to work. Our very first case was an attorney who had suffered from depression all of his life. He had never lost a case. He came to us in a depressed state. His marriage was headed for divorce. He received a number of treatments and had for the first time in his life what he describes as an absence of depression. He had had in the past relief from depression, but he always knew it was there. His wife came to us after he had no symptoms, and she asked, "Who is this man? I haven't seen him before." Still another patient showed us the remarkable change TMS can make in someone. He was an 87-year-old global business leader. When he came to us, he could not open our heavy office door. He always had help. He was a shell of the best he was. He began receiving TMS therapy, and then one day he arrived by himself. Dressed in a tailored suit with a bow tie and a flower in his lapel, our office staff asked him, "Can we help you?" Our office staff did not recognize him. When people suffer from depression, their character and personal attributes are often masked by the illness. Our experience in using TMS extends over 7 years, treating over 500 patients with close to 20,000 treatments. We receive many complex cases from other failures. We have been pioneers with TMS from the beginning. We published the first results of 100 patients treated with TMS therapy within the biopsychosocial model of psychiatry. We subsequently published our results with 300 patients and published the first real-world experience with OCD, fibromyalgia, and anxiety. We have been asked by many centers to share our treatment protocols and was sought to introduce the Japanese people to TMS. Japan's 2020 equivalent, NHK, followed 2 of our patients for 6 weeks, interviewed us, and aired the programs over 20 times in Japan. We find the clinical results with TMS therapy significant. In our center, we find that 73% of those that receive TMS therapy get significant improvement in their symptoms, and over 65% achieve remission. Remission is the total removal of depressive symptoms. These results are exceptional when you consider that these patients had not gained benefit from 6 or more medication trials. The other significant part of our results is that we recognize that taking the approach of just using TMS and sending a patient home without an integrated care would have less efficacy than our proven method. Our proven method is integrating the biopsychosocial model into each treatment, melding talk therapy, medication, and TMS to achieve the best results possible.